Out of the top 10 zip codes that have been impacted by COVID the most, 5 of them are here in New York 14. It was one part tragic, but on the other part, it actually wasn't as shocking.
Alexandria Ocasio Cortez, at 30, the youngest woman to ever serve in Congress, representing one of the most diverse districts in the country.
We're just a bridge over from Manhattan, yet we have twice the infection rate.
This is our community.
The Bronx native knows the added burdens that fall on children of immigrants.
When you graduated from college, cum laude, you came back to the Bronx to 10-bar wait tables. Why?
My dad had passed away while I was in college. My mom was a single mom. She was also a domestic worker. We were barely clinging on to our house.
Poverty correlates with a lot of these underlying conditions: hypertension, high blood pressure, diabetes. What should be done about these sort of systemic inequalities?
Inequality and poverty are in and of themselves pre-existing conditions. When you don't have health insurance and you're scared to go to the doctor, your decisions around your own health become primarily financial decisions, and it becomes gambling. And so, when we talk about what the solutions to systemic inequality is, it needs to be systemic solutions.
A hero to the left, a villain to the right, her progressive views often igniting controversy. This March, when even Congress was united, she voted against the massive COVID-19 relief bill.
You were a lone Democrat voting against the CARES Act. What was your rationale?
Knowing that that package had a $500 billion that would be leveraged into $4 trillion to a bailout for Wall Street with virtually no strings attached that would be preference to the wealthiest. I knew that that bill was not structured to solve our biggest problems that we had.
She gets plenty of attacks from the president on Twitter, but that doesn't stop her from speaking her mind.
He's virulently fighting against healthcare protections for immigrants. He's made people afraid to go to the doctor because they are concerned that ICE will pick them up in the ER. You have all of these workers that we rely on, and few of them are getting tested and the help that they need, but still going to work because they are so economically desperate.
Your mom drove a school bus, cleaned houses. What does an essential worker mean to you?
Any person in this country that is helping keep the lights on and helping us live day by day, whether it is the farm workers who are picking the food, whether it's an MTA bus driver. The great irony of essential workers is that they have typically been underpaid, under-recognized, and undervalued in our economy. And if there's one thing that I hope that this crisis shows us is that our essential workers deserve so much more.
Many companies are reportedly ending hazard pay at the end of this month or in the next few months. How does losing $2 or $3 an hour impact these workers?
It's shocking. They're saying, okay, we're taking away hazard pay, COVID is over. Not a single public health official would say that. $2 is everything to a worker that is choosing between milk and their prescription drugs. $2 an hour means the world to workers. It means nothing to Jeff Bezos. So why don't we just give folks the actual wages that they deserve?
With Congress not in session and the economy of her district in tatters, Ocasio-Cortez has been on the ground, focused on her constituents.
Do you think enough was done to protect essential workers?
Enough wasn't done. I don't think that we can look at this crisis. I don't think we can look at the numbers and say that we have done enough or that we did enough.
What do you think is required to sort of comprehensively fight COVID?
We need free testing, whether you're insured or uninsured. Why shouldn't healthcare be treated as a human right in any condition?
And what do you think, now that COVID has exposed those divisions?
It's kind of like a fork in the road, where on one end, we could say everyone around us is dangerous or disagrees with us. We could take the other path and realize that COVID doesn't care if you're rich. It doesn't care if you're poor. It doesn't care if you're documented, undocumented, black or white or Latino. This is a risk that impacts every single one of us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.